I guess it's really evening, everybody. My name is Rae Murray, and we're here with Everything is Public Health, our monthly podcast. And I'm really pleased to be joined by three excellent guests tonight. I have to point out that my co-host, who is usually here, Marcus Murray, has deserted us this evening, so we'll have to soldier on without him. But tonight, we're going to be talking to three young professionals in different stages of their careers. And we're really just going to be having a for real conversation of how they got where they are and what their plans are in the future and how COVID may have interceded. But first, as we often do, I'm going to ask each one. We'll start with Brother Alex here to introduce themselves briefly, and then we'll get going into the conversation. So go ahead, Alex.
Hey, Dr. Murray, thank you for having us on this podcast. So I'm Alex Kimbrough. I have a background in science, pre-med, but I went to school for public health. I got my undergrad from the University of Illinois at Chicago, and that was in biological sciences. Then I went back a couple years later at the University of Illinois at Chicago, got my master's in epidemiology. And so I went that was back in 2019. So most of my background for epidemiology is in infectious diseases and primarily HIV and STIs. And for the past couple years, I've worked locally as a data and quality manager at an HIV clinic where I do mostly data analysis and quality improvement projects to enhance our patient experience as well as improve our metrics that we have there. So yeah. Dr. Murray, you're muted.
I'm sorry, you would think I would learn after all these years on various technology. We'll do a deep dive into that interesting short version you gave us. Tiffany, maybe you could tell us a little bit about yourself.
Yes, thank you. And thank you, Dr. Murray, so much for this platform. It's nice to see Alex again and nice meeting Sonia, did I say correctly, Sonia? Nice to meet you all. So I have been in the field of public health / community health for, it's getting close to 20 years. I'll say definitely about maybe 16, 17 years. Been in the field for a minute. I actually got into the field before I actually knew, don't make fun of me, you all, before I actually knew community health was actually a thing, or public health was actually a thing. I had a passion for the community, and so I got into an organization that did HIV, AIDS, and STD awareness, and then I ended up starting my own organization that did that. We got a lot of people tested for, a lot of students and staff and community members tested for HIV. And then I realized, hey, that's actually a major. So I majored in community health. I was a pre-physical therapy major. I was going to be a PT, a physical therapist, but I changed my mind. I said, no, this is not my passion. Community health is my passion. So I changed my major to community health. I graduated in 2010. I was a professional student, to say the least, because I was an undergrad for a long time. But I graduated from Chicago State with my bachelor's in community health, and then I worked for a little while in the maternal child health field. I worked with a lot of underserved communities dealing with mommies and babies and infant mortality. I did that for a while. I became a certified lactation counselor, and I went back to school for my master's and graduated from Chicago State University in public health in 2017. So I've been doing this for a nice minute. I love it. And it's really a very rewarding field, I must say.
Well, thank you. And we'll go to our youngest guest here, who is about to graduate from UIC with her bachelor's in public health. Sona, why don't you introduce yourself?
Hi, my name is Sona. As Dr. Murray said, I'm a senior about to graduate from UIC for public health. And I've always been really interested in public health. My mom is she works for Illinois Department of Public Health. She does epidemiology. So I've always had an interest in that. I'm also pre-med, so I've been taking the science and classes that need to be taken. But I just started my pre-med journey my junior year. I used to be pre-dental, which the classes aren't very different, but the pandemic made me want to go into medicine actually. So that's how I switched.
So, this time of year is especially challenging for many young people because they're often graduating in something, and they may not be completely clear about what they want to do. So let me go back to Alex and Ed. I'm going to ask each of you, because Tiffany and Alex seem as though they did some things between their bachelor's, between their undergraduate education, and going back for a graduate degree and working. And then I know Sona has some plans too. So Alex, what happened when you graduated from UIC? Then what were you thinking in your head then? And give us a little bit of understanding of your journey.
I remember that distinctly, having a little bit of a crisis, honestly, because at the time I graduated with, I think a 3.03 GPA. And that was nowhere near enough to get into medical school. And I was probably, from the day I was born up until then, I wanted to go to be a doctor. And so I kind of was like, do I really want to go into, I had to ask myself at the time, do I really want to go into medicine? Is this really for me? And do I really want to put myself through that kind of pressure at that time? Or do I want to go back to take extra classes? And I think I decided on no. I wasn't really interested in medicine. I think I've always had an interest in preventing diseases instead of treating for them every day, which is what I probably would have been doing as a doctor. That now it's time for treatment, but I've always wanted to do more prevention. And so I thought about it for a while. Do I really want to do something like that? Do I want to be in public health? I think I also had a passion of being an investigator in some way. With my training with my mentor, Dr. Crane Watson, has always been more like research or investigating. And so I was always interested in things like, honestly, like true crime. I'm a huge true crime fan. And after I graduated, I thought I wanted to be in forensics. And so, because I always had a passion for forensics, and I remember watching a lot of true crime episodes. There was one about an outbreak where they called in medical investigators, which I interpret as epidemiologists, who came in and helped solve the case, because they just traced it back. They used a whole bunch of little math, odds ratios, and all that stuff to find out who came in, when was the spike, and stuff like that. I thought that was really cool. I was like, wait, this sounds like epidemiology. I remember having it before. And I remember looking it up online, like doing a lot of research of what epidemiologists do. And I was like, wow, might actually be something I actually be interested in. Like, it is kind of like being a forensic investigator, but in a different way when it comes to health. Like, instead of doing murders, I'm doing more, mortality or like something like that in the public health world. And so from there, I just, talked to my mentor about it. I was like, I kind of want to go back to public health, because in undergrad, we didn't really talk about public health that much. And then we did. I was like, yeah, I kind of want to do this. And I applied UIC because it was the closest one, firstly. And I thought that would be a really good place to start. And, went through the program, and several years later, here I am. I actually love it. I didn't think I was going to be a math or data nerd, but here I am. That's me.
Well, I know for a fact, I know this is true at the University of Illinois in Chicago, and I think it may be true in lots of places in the country, where somewhere close to a third to a half of entering freshmen, if you ask them what they want to do, they often say pre-med, even though UIC technically doesn't have a pre-med major. And obviously, not only is it not realistic, but I at least chalk that up to, that's all people know about. When they think about health, think about what they see on TV, nurse, doctor, it was interesting, Sonia, that you were pre-dental. I don't even think, especially Black people, I don't even think that many people even think about dentistry or physical therapy or other health fields. So what was your experience, Tiffany? You said you were a chronic student. But
yes. I was there for a minute, because I was like the students that you talked about. Like, I didn't know exactly what I wanted to do. I came in undecided. And then at first I wanted to be this journalist. I want to be a news anchor. Then I'm like, no, that's not what I want to do. Then I was like, oh, well, let me do business. I'm like, no, that's not what I want to do. And then I remember I was in a pageant, and I won the pageant, and they asked me what was my platform. And I just started saying my platform is going to be to help my people and do this and do that, whatever the case is. And so I started getting into that field, and I decided to be a pre-physical therapy major, because I always knew I wanted to help people, and I got a job working as a physical therapy tech, and I did that for like maybe a few years. But I remember one time I got really, really ill, and I was out of school for like maybe 2 weeks. I couldn't move around, couldn't walk, anything like that, and I had an epiphany. And And I promise you, don't think I'm weird. Maybe I was on medication. Maybe the medication kicked in, but I feel like God talked to me. It's like, no, I don't want you to do physical therapy. That's not your heart. That's not your passion. And I just started thinking about my organization that I had. I had an organization called STASH, which is Students Taking Action Against STDs and HIV/AIDS. And I mean, I always been about community, helping people that look like me, helping those who don't really, who get overlooked. So I'm all about finding a solution to the problem. And I was thinking about that. I'm like, you know what? Let me talk to somebody. So I talked to one of my advisors, and she was like, we have a community health major. I'm like, that's amazing. She was like, yes. I was like, oh, because she was like, I can tell physical therapy is not really what you want to do. I'm like, you're right. I was just going to do it. So, be Dr. Tiffany Johnson, DPT, all of that, I mean, but it wasn't what I wanted to do. And so I changed my major my junior year, which people thought I was crazy. They was like, you need to see a therapist because you changed your major when? You only have one more year to graduate. So I added 3 more years to my undergrad career, being a student, which made me stay in school for like 7 years total for undergrad. But I'm glad I did that because I'm one of the very few that actually found their passion in college, and I've actually stuck with it. I've actually been able to work in my field and use my gifts within my field. I'm like Alex. I've been a data nerd. I never thought I was a real nerd until I started, really digging into the data. I worked with the a violence intervention program that does a lot of intervention, and so I'm their data quality person. I do a lot of data analysis there, and I'm also a community healthcare specialist with a new clinic in the community. So, I'm glad that I had that epiphany, where I had a one-on-one with God, one-on-one with myself to figure out what is it that I really need to do. And I did I didn't know it was a major, because you hear about doctor, physical therapy, dentist, about those main things, but there's a lot of things that, I feel like we need to know more about. And public health, community health is actually one of those options that some people be surprised how they can find their passion within those fields. So I'm glad it happened the way it happened. It took a long time, but I'm glad it happened the way it happened.
Well, Sona, the interesting thing is when these two people were in college, at least I know at UIC and still at Chicago State, there was no major in undergraduate school called public health. That's a relatively new major, so I'd like to hear from you. What have you learned when being in UIC, and how do you think this conversation relates to what you're thinking about?
Definitely, yeah. That's one thing I really loved about UIC and Tulane, like when I was debating which college to go to, is because I really wanted to major in public health. Also, like what we were talking about earlier, like my parents are African immigrants, so the only careers we're allowed to do are doctor, engineer, or lawyer. So when I came to school, I was like, I'm not going to be pre-med. Like my mom was begging me to apply to the UIC GPPA program for like the guaranteed med school acceptance. And I was like, I'm literally not interested in that at all. That's why I didn't change to pre-med until junior year when I really was like watching skincare videos and like pimple popping videos. And that's when I was like, oh, I could be a dermatologist. Like I find this really, so it's really not even like, it was really something I genuinely came out. And when I told my parents, they were literally so excited. They didn't even support dentistry, which is also doctor in front of it. It's not something they support. They only see 3 careers, which is sad for a lot of college students coming in because they have to like stick to that. And like they're taking these classes and they're not enjoying it. I was always kind of a nerd. I went to a math and science academy, a boarding school. So I've always like been into math and science. So it wasn't necessarily the classes, but I could see like with my classmates, like all of them were like not in the next class the next year. Like when we were taking the general classes, they were not in the next advanced class because that's not what they liked. So I've just always tried to make sure like what I'm doing, like I want to do it. When I was pre-dental, it was because I was getting a cavity filled at a dentist office. And he was like, have you ever considered being a dentist? And I was like, no. So that's literally the reason why I was pre-dental, because of that one experience. I never had like something that I wanted to do. So I just had to do something. So and I'm also open to changing. Like if after I graduate, when I get a different job and I like that more and I want to go into something else, I'm fine with that too. So I'm never like stuck in one position, but as far as I like it and I want to keep doing it, I'm going to keep doing it.
So let me ask all 3 of you then, if you could do it over, or when you have your own children, what kind of experience do you think we should be giving, especially young Black kids, in terms of thinking about careers past high school and college?
Yep. Okay, go ahead.
Go ahead,
Oh,
Tiffany.
yes, sir. Oh, you know, just go ahead.
So for me, I really feel that at an early age, like I don't have any children yet. I'm a great aunt, a great aunt. So my nieces and nephews have children. So when I look at their children, I look at them like they're my own babies. And I just really try to spend time with them and see what it is that they like. I believe that you should never force a child to do something just because you want them to do it. You should always kind of figure out what is it that this person likes. Because a lot of times at a very young age, you can start kind of see certain gifts that they have, talents, things that they like to do. And so I think that, as parents, as a family, as a village that pretty much help bring up the children, you should really try to cultivate their talent, cultivate their passion, see what they're interested in, and also allow them to be exposed to a lot of positive different things, because that'll also kind of, allow them to figure out, what do I want to be? I think we shouldn't limit our children to just, okay, be a doctor, a lawyer, a scientist, engineer. To be honest, as much as I'm all about education, school may not be for them. They may become an entrepreneur right out of high school or pick up a trade. So I think it's really good to just really, spend time with children, cultivate their talent, expose them to different things that are positive so that they can kind of find who they are and what they like, but never force them into anything is what I like to do with that.
And Alex, you were going to say something?
Oh, yeah, I would say something along those lines as well. I think for me, if I could do it all over again, I would have definitely explored more public health. Like Dr. Murray said, that when I was at UIC, we really didn't have a public health major. I think it was probably during at least my senior year that I actually knew we had a public health major. And I would have definitely done a little bit more digging, but I think I was just like you said, Sona, about like even the Black community when it comes to health, we're just either a doctor or a nurse, and that's really it. Maybe a dentist, but like I like to ask my mom about I want to be an epidemiologist, and she's like, "What's that?" And I couldn't even tell her. I was like, "I don't know. I think they do something with diseases," and so it's very much like I think I wish I had been able to broaden my horizons when it comes to health. If I didn't want to become a doctor instead of waiting till a little bit later to kind of figure it out, I wish there was a way that like I could have learned maybe in high school that there are other options outside of being a doctor or a nurse or someone in the hospital. You can be a whole bunch of other things like a dentist or epidemiologist or, a community health activist. You could still work in health in a different capacity. And so I think what parents should do to, foster that exploration is to, read up on yourself too. If they instantly say, I want to be a writer, well, look up all the writing. Like me, I like doing research. So I'd be looking up all the writing things they could do. Like be a writer, could be an editor. They can be their own freelance journalist. They can do what's it called? Public relations, maybe something like that. Or they won't be a doctor. They won't go into health. They should, kind of be one step ahead. So at least you be aware of things if they don't know what they want to do. I think that's kind of a good way to look at it, is maybe like be one step ahead and cultivate help them, guide them as you go. You learn something, they learn something as well. I think that's what I would do. I don't have kids either, by the way, but that would be something that I would do, is kind of, try to watch them and ask them what they want to be, but also be aware of all the possibilities they can have. So at least I can direct them instead of them just, wandering a little aimlessly for a little bit.
Yeah. So Sonia, how are your conversations now with your parents, Sona?
They literally love it. Like before I told them, like I waited a while before I told them because I just knew that's everything they wanted. And I understand where they're coming from because you risk a lot, moving from your home, like coming to America, and they just want to make sure like their kids are doing, the best that they can do. And that's what they know is like being a doctor, engineer, lawyer, which obviously you can do the best you can do in any other career, but that's just what they know. But they're really excited. But honestly, they would have been happy. Well, not all the way. Okay. When I was in high school, I was actually more on the arts route. Like I wanted to do more writing, and like I even did like writing clubs and poetry a lot. So I wanted to like go into journalism, and my mom said no immediately. So basically being pre-dental was just kind of a placeholder for like whatever I wanted to end up doing. Luckily, medicine and pre-dental, like the science classes are almost identical. So that worked in my favor. But now that like they see me doing something and like I'm doing it the best I can, they would support me no matter what. But they are very annoyingly happy that I picked the career that they wanted me to.
So let me speak out as a grandmother here. I think that certainly for Black parents, you're trying. There is so much racism and stress in your kid's life, so you're trying to make it so, to the extent that they have an education. And let me try this. I'm going to be how can I say, politically incorrect. You try to arm your kids so that the white folks don't kill them instantaneously. That's really what you're trying to do. And so you want them to have credentials that white people recognize, not because you think those are the only credentials to have, but you want to try to, if possible, make their lives easier. I think that's why people push their kids to go to college, etc. Now, when I was coming up in the 60s, of course, my position was you have to have some skills in order to build a nation, in order to, have our people try to survive and improve. So you certainly need skills, but clearly those skills cover a whole range. I'm reminded of a class that we did with middle schoolers at the Little Village Academy a few years ago. Actually, Sonia, some of your previous classmates, some students from our undergraduate major went over to the school once a week. And it's a school where the curriculum is centered around social justice. And the major point of the course that the students did was around the Flint water crisis. But every week that we were there, we would pick a job that was related to health that came up in this Flint example. Now, obviously, we talked about doctors and nurses. We talked about epidemiologists, Alex, and told them what it was. But we also talked about artists. We said, well, when you are making a flyer to get people to come to a community meeting, or when you're trying to explain what lead does to you, you can do it through art. And you can get trained as a medical illustrator, for example, and of course UIC has a program for that. Or we talked about a lawyer. I said, you don't have to be a lawyer in a criminal case like you see on TV. You could be a lawyer around healthcare or around the environment. So we actually were able to cover almost every field you could think of. Music, there's music therapy. And so I think one of the challenges we have as Black parents and grandparents is to really help young people understand that first, they can change their mind, like all of you have done, okay? And secondly, you can take your skill set, whatever it is, and connect it up to what's going on presently, to something that's important, whether it's the murder of George Floyd, or whether it's trying to address problems with immigration and how we mistreat immigrants. Whatever it is, you can take the talents that you have, the thing that you're passionate about, and make a connection. So I think that's really, really, really important. Now, let me come back to, so how did you all actually make it through school in terms of tuition, food, housing, etc.? I know in public institutions like Chicago State and University of Illinois, at least 50% of undergraduates are food insecure at some time or other in that 4 years. So maybe you could give some of our listeners here an idea of some approaches you were able to use to make it through. Sonia, you're closest to this. Let's start with you.
Okay, yeah. I actually very fortunately received a scholarship from UIC, so I haven't really had to worry about tuition. I had to pay fees, but throughout the 4 years, they've covered my tuition and housing. Most recently, like now that I live in the on-campus apartments and not in the dorms, I have to like make food myself. And I got an email from UIC's financial office, and they were talking about how UIC students qualify for the SNAP program. So I actually just applied and got approved. And that really honestly has changed my life, because I was eating out a lot, but now literally I make like a list in my phone. I'm eating more meals a day and like healthier, I feel like. So before that, I was always like, bank account was running really low because I was buying my own food. And I don't really my parents would help me if I asked, but I just don't really ask that much because I'm in like a stage where I just like to be more independent. But I feel like I've been very fortunate in my college career from having this scholarship, which is why I chose UIC over Tulane. I have a scholarship at Tulane too, But I had to pay for housing, which is $20,000 a year. And I just wasn't seeming reasonable to pay $20,000 just to live there. So, yeah.
Alex?
Yeah, for me, so they were both degrees were vastly different. My undergrad, I paid student loans for, like, the first year was all student loans, and then the second year was half student loans, and then the other half I was an RA. So my room and board was covered because I was an RA in the dorms from sophomore year till senior year. That was an interesting experience, and so that was kind of how I paid for everything, and also with my meager stipend of $100 a month, I think every 2 weeks or something like that. I thought that was a lot of money back then, but $100 every 2 weeks, I was able to, get some food or some snacks, whatever I needed to. But yeah, a lot of stuff was through the gracious of my parents, but also student loans and just being an RA. That's how I made it through. Now my master's degree, that was very different. That one was after I worked for 2 years because I wasn't sure what I wanted to go back for. So I stayed at home. I was able to save up quite a bit of money to allow me to go to my master's degree, work as like a research assistant. And so I don't have to really worry about working super hard. But with that being said, my mentor, Dr. Kareem Watson, helped me pay through at least half my master's when it comes to tuition. Because I was working as a research assistant, and I was eternally grateful because that opened the door for me to become research assistant on another project, which helped pay some fees and gave me a stipend for that for my second year. So it was definitely a mix of research assistantships and just me paying off whatever I saved up in between my undergrad and my master's.
What about you, Tiffany? 7 years. You must have been humping there. What happened?
So let me start from the very beginning. Can you all hear me okay?
Yes.
Okay, good. So yeah. Well, I'm going to say this. Anybody who's in high school listening to this, take school seriously, okay? Because that's going to make your life easier when it comes to college and grad. Because I did not take education seriously in high school, to be very honest. So I didn't get any type of scholarships. I was an amazing person in grade school, but something happened in high school. I don't know. Something was going on where I just was not thinking about it. And this is for the people who are barely graduating from high school, but graduating. If you were a C student, you still can make it in college and in undergrad. You're just going to have to hustle hard and really, really get it together. You don't have room to play around in college and undergrad if you didn't get scholarships. And so when I first got to undergrad, my dad had just lost his job, so he was making almost six figures, all his money. But when I got into school, he wasn't making no money. So I stayed at Chicago State. I stayed at home. I lived very close to the school. So we saved money like that. But they went off of my dad's taxes from the last year. So I didn't get any type of grant money. So I struggled hard in my first 2 years. And what I did was I worked in the library, and I found scholarships through pageants. I did the Miss Black and Gold pageant. I did any little contest that I could do to get the money, and thank God for favor, I won those different scholarships that helped me because I didn't have any money. And at one point, I was working two or three part-time jobs and going to school full time to just really, really make it work. I took out a lot of loans, so many loans. I think my last year in undergrad, I ran out of financial aid, and I was just freaking out because I'm like, how am I going to graduate? I don't have no money. I had just got laid off from my job as a physical therapy tech. And I'm like, oh my God, what I'm going to do? And thank God for people, like some administrators in Chicago State, because I guess through me doing a lot in the school, I was really, really big on community activism. So I was doing a lot. They was able to find a scholarship for me my last year that paid for my entire tuition. But I would tell anybody in high school, take it serious so you can get that scholarship. If you didn't get a scholarship, it's not the end of the world. Reach out to people, get familiar with the people in your schools, because you can find money from different places. Now in grad, when I went back to grad, people thought I was a little crazy because I worked full time and I went to school full time. So I was a case manager, and at the time, my job was very stressful. I had a caseload of 200 mommies and babies that I had to provide services to, and I had 5 classes in grad, and everything was pretty much out of pocket and through loans. So that's pretty much how I paid for it, through working and and loans. And I would tell anybody, definitely those student loans are no joke. I'm still dealing with them now, and I've been out of school for a while. So I was talking to another young lady whose sons are about to go to college, and I'm saying, really do research. Like any parent listening, do research. Even if you're a child or a student of any age, do research and talk to people so you can get those scholarships, because they can be really, really helpful. Because one thing, I'm gonna be very honest, I'm happy about all these extensions about the student loans, but I'm about ready for them to say, you know what? If you are an individual of African descent, your loans are paid for, are relieved. That's what I'm ready to hear. Give me something like that. Okay, these extensions, okay, yay, great. I have another 5 months or 3 months before I have to start paying back, but relieve those of these student loans, because I have a lot of them.
Well, that's one thing a lot of Black people don't fully understand. In some places like Germany and France, you don't really, college is basically paid for. If you have the skills to get into a certain institution, you're not paying out of your pocket, and that makes sense because it's an investment in the future of the country. So I know that. I think it was Bernie Sanders who called for free college tuition. I just don't think people should have to pay for college in the same way that people shouldn't have to pay for high school. And today, I don't care whether it's one of our 4-year academic colleges or an apprenticeship program or what, but today you really can't make it through your life just based on K through 12. You're going to need some training after high school in whatever format it is. And there's absolutely no reason why people should have to go into debt. I understand people do, but people have to go into debt. So that's a major thing. And in fact, to be honest with you, and I'm sure my public health colleagues will agree, this is a basic public health challenge. We know so many things that are connected to education, not just the fact that the more education you have, the more likely you are to have a higher socioeconomic status, which obviously helps your health, but also just the process of getting some kind of formal education after high school. Again, whether it's as a carpenter or a bricklayer or a physical therapist, becomes so important in terms of one's health. And so to me, the fact that we don't encourage people to have lifelong learning, one of the things my mother told me, she was old, she might have been retired. She basically said that if you didn't do a formal course at least once every 10 years, okay, so she's like 60 when she's telling me that, your brain will turn to mush. That was her position. So she said, you should be enrolled in some kind of formal course. Don't have to be a degree. Some kind of actual course where you have to read and think and write once every 10 years. Otherwise, your brain will turn to mush. And I actually think that that's true. So for public health people, then, having an educated public, a general public, is so critically important, which leads me to my next set of questions. Two of you, Tiffany and Alex, you've both worked around the HIV pandemic. So a lot of people think coronavirus is the only pandemic we've had. Well, I've seen 3 or 4 or 5 in my career as a doctor, and just my personal career, the largest of which and the most devastating of which has been the HIV pandemic. So I'm curious as to what you learned from your working around HIV/AIDS and how you think that informed what we've been going through for the past couple of years with coronavirus.
Alex, you want to go?
Oh,
all right, Alex.
That one is, oh, geez, that's a lot. That's as I'm thinking about it for a couple of years. Yeah, that's an interesting question, and I think what I learned through at least working as a data manager, not really hands-on, but still working through the data and seeing and being in those talks of how we, how data informs what we're going to be doing through the pandemic. I think it was more like for us, I realized that people, I guess, like when it comes to patients and their health, they're still concerned about the newest things that arise. Like a lot of times, a lot of our patients were hesitant for coming in because they were afraid of COVID. A lot of patients did develop anxiety from COVID. I mean, they probably knew that they had to, come in and see the doctor, but they were also just like, I don't want to go into a place with a lot of sick people because I don't want to get sick. So it's kind of this balancing act. And then also the same thing that affect the general population, job loss, like general anxiety, or like being unable to pay for things, the loss of toilet paper, that whole craziness, that affected our patients as well. And so we experienced a lot of like behavioral health increase in what we wanted to do. And I think we also, as a place, became more sensitive to the needs of our patients. We created like gift bags. We called them a lot more often because we knew that this was a crucial time for even some of our newly diagnosed patients, that they might fall out of care, because this is a time where this is the added stress. And sometimes just taking the medication or dealing with it can be a stress within itself. And then you got this on top of it, and it becomes a whole mess. And so this definitely, at least from what I saw, was a contributing thing to some of our patients, losing touch with their care. But however, it did, honestly, the pandemic did create a boon, I think, in a way, because it forced our health system to adapt. We started doing telehealth visits, and I remember a couple years before that, they threw around the idea of televisits, but they weren't really pro televisit. And so in the pandemic, our patients were a lot more willing. The ones that had been gone for a while came back and were interested in doing telehealth visits. And so we saw our retention rates increase. And since we phased out telehealth visits, unfortunately, we've seen those same retention rates decrease. And so I realized that in that pandemic, it was a nice gem throughout all the rest of the coal around us. And so I think we need to, it definitely taught me that there are different ways to engage patients outside of just the typical coming in for a visit. There's like the televisits. And I think we should work toward meeting our patients where they're at when it comes to their ability or disability to get into care or getting into our clinics. So that's my experience I've seen over the past couple of years.
Tiffany, you were going to say something?
Yes, for me, when I think about when I first got into community health and public health, starting in the field of HIV and STI, and being around, around that time when HIV was really the talk all the time. It was like, it was like on top of the list when it came to any type of health fair, anything dealing with health. That was the main focus, was HIV, the epidemic that the country is still experiencing. But at that point, the treatment, everything was just, kind of new. And we were just really trying to figure things out. And testing was a big thing. And what I learned from just working in the field back then and working now in the pandemic is education is so important. Like even when I was a peer educator for HIV/AIDS, and I would talk to the students, busting those myths, giving people the proper knowledge, showing people how to do the proper research, not getting stuck on so many conspiracy theories, busting those myths, really, really providing awareness, I found is really, really important, even in this pandemic. We're dealing with COVID-19, because I remember when the pandemic first started, there was a rumor going around, a myth going around saying that if you were of African descent, then you were good because of malaria back in Africa and the way our cells were mutated, and that was like, oh my God, so dangerous, because you had all these young people who was from, getting information off of social media thinking, oh, well, I'm okay. That's a white person disease. That's what people really say. It's a white person disease. And it really probably killed a lot of people because of that, because of the lack of education and the myths. So, coming into the pandemic, approaching people when it comes to COVID-19, I try my hardest to provide them with as much information for them so that they can make the best decision for themselves. When it comes to getting the vaccine, I know a lot of people are torn. Some people want to get it. Some people like, no, I don't want them pumping that mess in me. It's all type of theories that people have. And it goes back to when I was in the HIV/AIDS field. I have to educate them. And then after I give you the education, like I had to tell a student many years ago, don't use 2 condoms. That's not going to help you. It's going to be worse. Well, I heard it's not going to, no, it's, trust me, you're going to expose yourself if you use two because of the friction, so busting myths, I feel like is really important. And, when I talk to patients now, I talk to individuals now about COVID-19, like I said, I try to give them as much information as possible, show them where to go to get their information, because a lot of people are always on their phones, always on their computer trying to look up things. So I try to, gear them towards the right information so that at the end of the day, they can make the decision that's best for them. And that's what I learned with with this pandemic, coming to this pandemic. And prevention is important. I think being public health professionals, one of the things that we really are kind of experts in is prevention. What can I do to prevent this from happening? What can I do to prevent COVID-19? Nothing is 100%, but how can I reduce my risk of either exposing somebody or, get it myself? And so what I try to do is just really break it down for people and just tell them, okay, well, if you don't want the vaccine, at least this is what you need to do. Wash your hands, cover your mouth properly. Okay, don't touch your mouth, don't touch your face. Give people some space. If you're going to go out in public, wear your mask, or, I try to break down the type of mask that you should wear when you're in certain places because of how it's, how it works. So I'm really big on prevention. Prevention is key, so, and that's how I pretty much approach the pandemic, because it definitely was an eye opener in terms of where we're at, even as a community, how fearful a lot of us are when it comes to health professionals like doctors and things like that. Some of our people are very wounded, from the African American community. And so, I really try to have one-on-one with people and just really meet people where they're at, give them the best information as possible, understand why they may think the way they think too. Just because I got my degree in this doesn't mean that I'm better than them, but I want to be able to provide them information with it so that at least we can kind of prevent things and slow down the exposure of this particular virus, the same way as I did when I was in the HIV/AIDS field.
So this pandemic has taken up 2 years of your college career. How do you think it's impacted what your plans are for the future?
It has taken a lot of my college. I feel like it's making me make sure that I'm just trying to enjoy everything that I do, because you just really never know where the world is going to go. And I also feel like it's really helped me understand public health even more throughout these 4 years, because we've had a real life example of how important our field is and how bad it can get if we're not working on these preventative measures. And it's changed a lot, but I can't imagine how else it would be, since I had no choice but to have this in my college career. So I feel like I'm grateful for the things it taught me. I still wish it, would have never happened, but I feel like it's taught me a lot, if anything.
So one thing I'm interested in, because I know all of you have plans for the future, first of all, because you're intelligent people that are thinking about what we need to do. But I'm particularly interested in what advice you have to young people, whether they're graduating from high school or perhaps graduating from college, or have their first job and are thinking about where they want to be in the next couple of years. What kind of advice would you give them in terms of things that they should do to allow them to have the best options they can possibly have for the future? Why don't we start with you, Tiffany?
Explore. Don't be afraid to explore. If you get into a major and you don't like it, it's okay. Explore. What it is that you like. Expose yourself. Read up on some things. Figure out. Shadow people. If you're interested in becoming a nurse, try to shadow somebody that's a nurse. And figure out what is it that you really, really like. That's one of my advice I would give to somebody who wants to go back to school, or a student, or anybody who's listening to here. Just really explore what it is that you want to do, and it's okay if you don't know. Don't freak out.
And let me just ask, what do you think you might want to be doing in the next 5 years?
So I got it all planned out. So here, this is how it goes, Dr. Murray. So one of my dreams is to have my own clinic, and this is something that I've wanted since I was maybe 19. I want to run my own health center, because being a case manager for so many years, in my previous jobs, I was a foot soldier, and I was working, one-on-one with my community, with different people from other communities as well, because I was all over Cook County, and I would tell people, the powers that be, this is what they need, this is what they need, and they go, oh, whatever. And a lot of people, I hate to say, who were making decisions for funding or policies, they just had a business degree. They had no clue about the health field, really. They had no background in public health or community health or anything dealing with people. They just knew about business, and that's it. And it's good to have a business degree, but they didn't really have that. So as I started, years started to progress, I said, you know what, I'm going to open up my own health center, and I want to be able to help people who need it, seniors, marginalized communities. I want to be able to help them. So that's my plan. I'm working on it, making sure my credit is straight, getting as much information as I possibly can, because at some point that is my dream. So in 5 years, hopefully I'll be cutting a ribbon, and I invite all of y'all to my opening.
Well, Brother Alex, I know what your immediate plans are, but so tell us what you plan to do over the next several years.
So my plan over the next several years is, well, I'm into graduate school. I'm going back for my PhD in epidemiology. So if you're talking about literally the next 5 years, that's pretty much my life. Just doing epidemiology, just being a graduate student. But I think in that interim, it's still going to be exploring, putting myself out there more, and trying to soak up all the experiences in a different, I would say, in my world, different world. Like, living in Chicago my whole life, I know Chicago pretty well. Then moving to the South, to a completely different region, different climate, different people, different culture, different history. It's just like, it's completely different. So just trying to soak up being more cosmopolitan or, more national when it comes to my interest in my experiences. So that's partially that. But I think in another, past that graduate school, getting that degree, learning about research, making those connections, I really want to, my goal has always been to kind of be a researcher, but as well as a person that's doing knowledge translation for communities. And that's the part of what I do. What I do is that I want to take this knowledge, what I learn in research, and put it into communities where they can use it and bring it into action. Because I've seen it in practice. When I worked with my mentor, Dr. Kareem Watson, he brought in the staff. He brought in community members as citizen scientists, and these people they came in, they learned about like how grants worked, and they were really fired up. Like, wait, we can do this. We can take this data that you guys use to sign up for this grant, do this grant, this grant, and we can help our communities in this way. And so I realized that people were actually hungry for this knowledge so they can help their communities, and I want to be a part of that in some capacity. But also, I want to be in a spot where I can implement change. In places that I've seen a lot of where it's been lacking, and being that voice for my culture, my community in those spaces as well. Hopefully with this degree, this more experience, I can be in those spaces. So that's kind of my 5-year plan. I think it gets hazier after graduate school. Like graduate school, I have a whole idea, a whole itinerary, but after that, it becomes a little bit hazy. I just know specifically what I want to do, but not where I'm going to be, if that makes sense.
Absolutely. And Sona, what are your plans in the next 5 years?
So for the next 5 years, for the next 2 years, I will be working at the job that hires me. So we'll see what that is. Also taking the MCAT, and then next year applying to medical school. So then if that goes how I want it to go, then in 5 years, I'll probably be in my 3rd year of medical school, trying to just manage through that in general, because I know it's not going to be easy, but.
It's great. So this has been a great conversation tonight. I really appreciate all of you sharing your experiences with our audience. And again, I want to remind people that there are lots of programs out there that can help you think about what you want to do. And please feel free to talk to people that you know and people that you don't know, and if you can follow somebody around and shadow them, that's really important. But the main thing I think is what Tiffany had said earlier. Don't be upset if you change your mind. It's okay. The main thing is to have a plan and keep working on that plan. And if that plan changes, that's all right too. That'll be okay. You have a community. It does take a village, and you have a whole community, certainly in healthcare, of health workers and health professionals that love to help young people come and explore our field. So I welcome you to do that. But that's true in all of our other fields too. So we have to do that. And one thing I will say, one way to make sure that you have plans for the future is to reach back. So if you graduated from high school a year or so ago, I don't care what you're doing, you're working, go back and visit. Go back and visit your elementary school. Go back and visit your college and talk to people and let people know some mistakes you made and some things you learned along the way. And when we do that, when we help each other out, then we have some chance of going forward. So again, this show is so important. And I want to allow everybody to think about what message they want to give for the future and what kinds of challenges do we face as healthcare workers in the future. So for me, for example, I am just very upset about how we've been dealing with this pandemic as a country. I think we haven't done well compared to other countries. But I want us to, as a people, find a way to have discussions and help each other out, not just with this pandemic, but with the other pandemics we face. The fact that so many of our kids don't learn how to read, or so many of our kids have trouble paying for college, as we heard today, and making the changes we need to make sure that the next generation can make some progress. But let me ask each of you, what kind of challenges do you see, not only for yourself, not just in a personal way, but your sort of generation, but what challenges do you see for us as a people? I'm gonna start with Sona first, because you have the most time to make some changes. You're the youngest on the show. So let's start with you.
I feel like the main challenges is there's just so many structural barriers, like structural racism, structural classism, that is affecting how we are even able to approach health, especially in like the Black community, because with just being conditioned into America, not being able to trust anyone, not being able to trust health, like we have to make such concrete changes to even get to a point where we can improve, like, you know, instituting like Black people can have free tuition in college and stuff like that. I feel like the biggest change is just the mindset, I guess, like trying to impose people to have more critical consciousness and like think about what biases they have with that inside themselves. And I was actually talking to my sister about this. She's 30 and she's a medical resident. And I was on a bachelorette trip with her and all her friends that were 30 and I'm 21. It's not that big of an age difference, but it's still like a different generation. And I was talking about like, just like different biases that they were like having. And they're like, oh, I love how the younger generation is so like woke. And I'm like, at the end of the day, it's not really just on the younger generation. You still have to make those changes, even though you're excited that the younger generation is talking about, you know, why it's not good to be ignorant, homophobic classes, stuff like that. So I really think it's just like really addressing yourself as like, oh, I hold a lot of problematic beliefs and this can really interfere, especially like she's a doctor. This can really interfere in a way I'm working with, you know, maybe I'm working with a trans patient. I have these biases in my head and that can really impact them. So that was a lot of different things, but trying to readdress these structural barriers and just critically looking at yourself and like what issues and biases that you have that are affecting others, that are limiting their health.
Thank you. I think that's important. And you're right. There is a generational between 21 and 31 that doesn't seem like it, but you know, 10 years is a generational shift. Alex?
Oh yeah, I was gonna say I'm around that age, so I'm like, I'm 29, so I'm definitely like, but the Gen Z, I definitely can agree that like I remember like being a millennial, we're kind of like the ones that were kind of, I would say a lot more like progressive than our Gen X predecessors, and so we were definitely. They'd be like, "Oh, these dang millennials." That's basically all they would always say is that these dang millennials, because we just kind of like more progressive toward other things. And then you guys I think Gen Z's pushing that even further, which is really I think that's what they're kind of like saying is that like we were kind of there too, but then like you guys took it a step further, which is really good. Instead of like some of our Gen X parents were still a little bit in a different mindset than what we were. So. For me, I think one of the biggest challenges that I've experienced is that when it comes to dispelling myths and just being literate about what health is and the truths behind some things that are going through the media, always have discussions with my barber about conspiracy theories and about how what all these diseases, HIV was man-made, COVID was man-made, and how you shouldn't do this X, Y, and Z because it's going to affect you X, Y, and Z. And it becomes exhausting for me because I have a compulsion to be almost pedantic about things where I'm like, actually, not really. And so, but that's one person that has their whole mindset built around something that is not. It's partially, there's some things that are true in there. Like I'll be nodding and then he'll just go left, and I'm like, wait, that doesn't make any sense. And so, but a lot of the times that my goal, I think, is a challenge as a Black community is being, like I said, being literate about health literacy. And we were talking about in my job title, health numeracy, about understanding, even your blood pressure, what that means, those numbers mean, and you need to stay below a certain amount. How do you do that? And if you're close to it, is it good or is it bad? Stuff like that. And so just becoming more health literate, I think as a culture would be, I think, I wouldn't say it's the magic bullet, but I definitely feel like we become a lot better. But that obviously is limited by, structural barriers, the social determinants of health, and where you can get that access to that information. But like I said, that's probably the biggest challenge, I think, for us is just becoming more health literate and finding a way to dispel all these myths and just trying to get the truth out there. And that's kind of what I want to do with my career as a researcher, is to get the truth out there in some way that is digestible, understandable, and irrefutable, if that's even possible. So, yeah.
Tiffany.
Absolutely. Like I agree with both Sonia and Alex. It's about the mindset. I mean, I think one of the biggest challenges, a few of the biggest challenges that I've experienced, especially now, is really having people remove politics out of health. I think when it comes to this pandemic, I think a lot of politics kind of interfered with a lot of people's decision with the pandemic, with if they're going to wear the mask or not, if they're going to get the vaccine or not. I think that kind of affected a lot of people's decision, and it goes back to health literacy. Just helping people become more literate and teaching them how to navigate the health system, teaching them about prevention, teaching them how to get the truth and not just base it off of conspiracy theories. And I think specifically for our culture, our community, and people of color, how can we get them to trust, in a sense, because that's a really sensitive subject when it comes to trust in the health field in our country. When it comes to Black people, it's the trust is not always there, and I think that also hinders people sometimes from receiving certain information from us. So while we're trying to bust myths, it's like a part of them right here, like, so you were trained to say that to me, so I'm not even gonna listen because they brainwashed you to tell me that, and so it's like trying to break that barrier down, trying to really, really help people find the correct information. And I tell people, science is science. I broke that down. I had a conversation with a friend of mine a few days ago, and he kind of had a conspiracy about certain things. And I broke down what science meant. It's not an opinion, it's facts. Like if I was to hold my hand up, 1, 2, 3, 4, 5, I have 5 fingers. That's a fact. I have a 5. That's not my opinion. That's fact. And that's how science is facts. It's something that we can prove is right. Now, when we take away the politics, then people can understand that science is not an opinion. It's not about the right or left. It's about true evidence and facts. And once we kind of relay that to our community and help them to understand and break down those barriers, I think we can kind of, help resolve some of those challenges that we have, and we're trying to educate our community about it. So that's the biggest challenge I have is a lot of these theories, and I got a chip in me now because apparently I got the shot. It's just busting those myths has been a challenge. But I've learned to have patience because I understand where they're coming from. I look at it like I understand because I grew up knowing about Tuskegee. I grew up knowing about the different experiments, so I understand where a lot of people from our community is coming from. But now it's like, okay, how can I help them help themselves? What can I do? How can I guide them to the best decision for themselves? So yeah, that's been my biggest challenge. But I have faith that we're going to make it. We're going to get through this.
Well, again, I want to thank you for your wisdom and your thoughts and your good advice today. Let me speak as an old person here, as a boomer. I think the critical thing to remember is the world is constantly changing. And certainly Black people, not only in the United States and in the Western Hemisphere, but all over the world, we have been oppressed for so long. There's no reason. The world has not earned our trust. But the solution to that is to teach, to learn and teach and talk with each other and make some decisions and really have the power that we need to shape reality for our children and our children's children in a way that's healthy and that allows us to thrive. So that's been a struggle for thousands of years, and certainly for the past 500 years here in the Western Hemisphere, and it remains a struggle. So I want to thank all three of you for joining us tonight. And as we talked about everything, public health is everything. I invite our audience to join us the third Thursday of the month, and I'll ask Brother Dre to take us out.